Hello family, Dr. Anta here again. The month of April being celebrated as Autism Month. You're going to be hearing a perspective from a caregiver who have experienced a family member while doing her care who has and had autism. Unfortunately, the patient deceased. But a different perspective because for the entire month of April, I'm sure you were tuned in and you have heard a lot about autism. Now, let's take it from a different perspective. Yes, family, as promised, we will be speaking to a caregiver. Now, we are doing this Autism Month education awareness with a twist. We need to know what is happening to these patients, to these individuals when they get home. What is happening, what their lifestyle is like, how do they manage? Yes, you move from an institution, you've been diagnosed, you have been having treatments for whatever reasons, and you are home now. What happens? Now, my special guest, which will be anonymous, of course, has and had the opportunity to be with an autistic patient for 20 years. I would say 20 plus years now. It doesn't get any better than that, right? So we are going to be having some awareness and also some, insight as to what happens and what can be done. And you will definitely be learning some definitely routines and some strategies to deal with these patients. So stay tuned. Now we will be speaking to a caregiver who is untrained to look after autistic patients, but she was placed in this situation. Now we need to know, how did she navigate through these situations over the years, because she had to be with this patient for over 20 years. Now stay tuned again and just listen up and you'll learn a lot from this interview. Thank you so much for being a part of Autism Month, which is the month of April, right? We're down to the wire. A couple minutes left before, our moments, our hours left before we close out April. Now, we have been having different perspectives and different, pathophysiology, literature, education, awareness, highlights on autism. Now, I'm sure everyone needs to know what happens behind closed doors, especially at home. Now, for your situation, I'm sure it is not just isolated. It is unique because these are situations that are happening, be it for economic purpose because they can't afford to get a practical nurse or a trained caregiver. Some persons utilize whomever they have at home. People will call them housekeepers, the help, or whatever, house managers. Different names are given, but you were asked to fit in and you're not trained. You have no medical background. You don't know what is happening. Tell us now, what specific challenges or behavior does this patient have, the patient that you had? And I have to remember that he is now deceased, so we need to be saying has and had. We will be doing that throughout the interview because he's now unfortunately dead.
Well, for me, most of the challenges that I had with him, with him was his behavior. You have to learn to control him behavior, because most of the time he will just run out of the house, and up and down you have to behind him, and then I have to learn how to deal with him and like to control his behavior, like for him not to do certain things to put me in any problem, because I wasn't aware of his sickness. Nobody told me about his sickness. So because I love children, I tend to talk to him calm, you can talk to them calm and say, okay, you want to go outside, we'll take him outside, let him run around, make him be himself. And some of the challenges again is that he will scream You will get physical. You have to learn how to control that too, because they're them physically abusive at times, and you have to learn how to control that. But for me now, it was easy for me because the love that I have for him, never shows so much of the physical abuse towards me, because I love him and I show him love different. I talk to him, make him feel like, him normal. Because most parents don't do that. Most times when them having issues or even acting out, the parent will try to calm them down with, oh, you're hungry, you want some food, not interacting, because they like to interact, even though most time they cannot communicate, but them like to interact. So you have to learn them behavior and learn how to deal with that child. That, you can see that you're communicating with him in different ways.
So the meltdowns that he normally had, what you had to do is just basically
be calm.
Okay.
Don't get too loud, because once him get in a meltdown and you get loud with him aggression build up.
Okay.
And him start to throw things, him have tantrum, him will lick you down, him with anything him catch, him will lick you with it. So you just be calm.
So what you're saying then, when you call them by name, when you call him by name, he actually responds to it favorably, like he becomes calm, no longer with, like, from a meltdown. Once you call the name, he will become back to his normal self.
Basically, you have to be calm. You can't be aggressive when they are getting aggressive, because once you start to shout at them, remember they can't communicate well, because most of them don't talk. Them can't communicate properly if you tell you how them feel. So you have to understand what him trying to say, and or what him want to do. And to calm him down, you just have to be calm and say, okay, you try to change the subject, and whatever I'm getting aggressive about, you change the subject, and you can say, okay, and you change the situation, and you can say, okay, you want us to go outside, you want us to, you can say you want us to have some playtime. You just change up the whole thing and bring some new ideas to him, and then he will tend to want to listen. And I say yes, and you bring him right back down.
So he actually communicates with words.
Yes.
Okay.
He can't express himself, but him understand exactly what you are saying to him.
Okay.
Yes.
And this has been going on for
years.
Oh my gosh. So what I would like you to do for myself and my listeners is to just walk us through a typical day. So you get there in the morning, because it's not a situation that you are staying overnight.
No.
You come in the morning. So when you get there, what happens?
When I get there in the morning, my morning with this specific patient is that he always wait on me for me to bathe him. I have to bathe him. I make him feel comfortable. I try to show him like a slang, because him don't have any other children around him communicating with him. The parents, them don't really communicate with him like how, me as a caregiver communicate with him. I show him some like a slang to make him feel like him is a part, when him turn teenager, like make him feel a part, like, him understand certain things, like, so when you bathe him, we say, well, I say, cha-cha boy, your man, you look hot today,
So what you're actually saying to me now is that you try to not only desensitize him with your untrained self, I would say, but you also actually to let him feel a part of what's happening in the current world, by letting him, you use certain, as you said, slang that he will be more aware of what is happening or can relate to, just to let him feel comfortable around his own environment, and of course, feeling that he has other pals, or like you are one of his pals. Now, it is an unfortunate situation, family, because this is what's happening. This is one of many things that is happening behind closed doors. And yes, we will definitely fabricate it, and we will come up and, persons will say, oh yes, I have an autistic child. Yes, family, a lot of this is happening, and we need an awareness. Things are happening behind closed door. Yes, it's persons or individuals or families' business and their personal life. But then guess what? The kids are being affected, and they intend to actually respond in negative ways. And guess what? Again, the caregivers who are normally untrained, because again, as I said to you, economic reasons, you probably can't afford a practical nurse or a caregiver that will attend to these autistic kids or a child. But guess we have to understand that there's no shame about this. It's not something that you were purchased or you go to get. Whenever you have a child, sometimes you don't know what is going to happen. Of course, now we have technologies that you can know beforehand, but we are dealing with a situation at current. No need to be ashamed. Just come forth. Let everyone know. You need to get everybody on board. Sit down. Nobody is beneath anyone. You need to understand what is happening with your child in your absence. Cameras won't do it alone. Let your caregivers know. If it's a situation that you can't afford to get professional help, then let everybody know what is happening. Let everybody know what is happening. And guess what? It's a family. Remember, nobody is beneath anyone. It's a unit. Respect is given, respect is received. Just remember that. We are all one big family. We need each other. It's a body. The head cannot function without the rest of the body, right? Hands, legs, buttocks, everywhere. Abdomen, we need it. So don't feel and let anyone feel as if they are beneath or less of. You need them. And thank you so much again for being a part of this program where we get perspectives and insights that, of course, we would never expect would have happened. But it is happening. And thank you. And you continue keeping up the excellent job that you're doing. And never forget that social media is there for all of us. Whatever is happening in your environment that you think doesn't look real, communicate. Use your social media and find out what is happening. Be safe. Now, family, you have heard it. Let us now be ambassadors of great, positive, healthy changes. Together, we soar and succeed. Bless. Bendiga.